Thank you for joining us to learn more about what AusHEAL is doing in the Democratic Republic of Congo. We are really disappointed that we cannot hold our annual fundraising dinner and speak to you personally. But we're using technology to try and make you aware of what the work of AusHEAL involves. Maybe in the past few months you've been feeling a little disjointed with the COVID-19 situation, maybe some isolation and experiencing difficulty in obtaining some products at the shops and other issues like that. Well, for many people in Congo, that's the norm. And perhaps this is an opportunity to feel what it would be like for it to be a Congolese person. They've not only had COVID-19, but they've had Ebola for the last 12 or 18 months prior to this. And there's been restrictions on what they can do. And there are even greater restrictions now with COVID-19. So as you hear about AusHEAL's work tonight, please think about the Congolese people. And we would appreciate you joining us, AusHEAL, in supporting the work that we're doing there. Unfortunately, due to Ebola in 2019 and COVID-19 in 2020, we've been unable to send our multidisciplinary teams. But we have continued the second aspect, which is teaching and training through our long-term workers, and also more recently we've been using technology with Zoom calls on a regular basis to our basic surgical trainees to continue the training that they are doing. The third aspect is that of scholarships. We have been providing a scholarship for the training of Dr. Barthelemy in obstetrics and gynecology in Kenya. Sadly, again due to COVID-19, his course has been extended for 1 year, so we need to continue to fund his training. We've also started the training of Dr. Justin Sandaraki. Justin was one of our fine basic surgical trainees who passed his membership exam of COSEXA in December 2019, and we're now funding him to travel to Tanzania to spend the next 3 years training for his fellowship in surgery, and he will eventually return to Congo as a fully qualified general surgeon. The fourth aspect is our short-term development grants. With these grants, we fund a Congolese staff member to travel to a neighbouring African country for up to 1 month at a cost of $1,500 to learn about their particular area that they're working in and upskill them. The reason we do that is that many Congolese have not travelled outside their country, and to put it bluntly, they do not know what they do not know. Already this year we have funded a midwife to travel to Tanzania to learn about midwifery, and she's returned and will now be training others. The fifth aspect is logistics. We, when appropriate, supply equipment and other means to support the healthcare. In the last 12 months we have provided an echocardiology machine, and that is to assist Dr. Elbin, one of the physicians at the hospital, who spent 3 months in Kenya in 2019 with a short-term development grant learning about echocardiology. But when he came back to the hospital, the equipment was not adequate, so we've purchased this new equipment for him. That is just one example of the logistical support that we provide.
The 72nd World Health Assembly designated 2020 as the International Year of the Nurse and the Midwife. This honours the 200th anniversary of the birth of Florence Nightingale. It also recognises the daily contributions of nurses and midwives to the health and well-being of populations across the globe, including in the Democratic Republic of Congo. In the history of Congo, nurses have played a key role in delivery of health services, particularly when there were limited numbers of educated doctors. Nurses then provided primary health care, performed surgery, and delivered babies. And many still do. The nurse or midwife spends more individual time with the patient and gets to know them in a more personal way, and nurses and midwives are key to providing good outcomes for patients. In the last 10 to 20 years, with increasing numbers of medical schools in Congo, more doctors are graduating. Nurses have therefore taken on a more traditional role as we know it in Australia and other parts of the developed world. The role of the nurse and midwife is nevertheless so important as part of the team delivering healthcare. When AusHEAL commenced its association with the AusHEAL Africa Hospital in 2006, nurses had been seen only as unskilled helpers. Since the first AusHEAL team visited Congo, nurses have been an integral part of the teams. AusHEAL, through its nursing teams led by Cheryl Brooks, has trained the Congolese nurses at AusHEAL Africa Hospital to understand the key role they play in the delivery of good healthcare, and in particular, AusHEAL has sought to empower nurses to excel and take the lead.
Hello, my name is Cheryl Brooks and I'm a volunteer nurse with the AusHEAL team, and my first trip was in 2008. So during that time, 12 years has passed, and I guess it's a great year to reflect on some of the achievements by the nurses at the hospital in Goma, especially since it's the year of the nurse and midwife, and we want to celebrate some of those achievements. Some of those I'd like to highlight are a greater focus on nursing education, and that's really meant greater confidence in the nursing team there, as well as an increased pride in nursing as a profession, and that's wonderful to see. A part of that has been providing training to respond to emergency situations specifically, and I guess in regards to the recovery area of the nurse, this is quite pertinent because those nurses will on a day-to-day basis need to respond to post-anaesthetic and surgical complications as they arise. So we've really had a big focus on recognising the deteriorating patient and how to respond appropriately and in a timely manner, and I've really seen a massive improvement in this. Part of that is organisation and accessing emergency equipment. So the nurses have spent some time in organising their departments so that that's made easier, and also documenting patient care. We've seen a dramatic improvement in that with the development of observation forms and accurate documentation. And so this then translates to better handovers. So we talk about the patient story when we hand over a patient to the next person or group that will be taking on the care of the patient. They need all the information. It needs to be timely and accurate and quite detailed. And so we've worked on the patient story, and of course at the end of the day that means better diagnosis, better patient care in general, and choices of treatment. So that's been a great improvement in the last 10 to 12 years. Another thing that we've seen is the development of short-term grants for nurses to go off and do some extra study, and this has just been a wonderful opportunity for them to gain some greater skills and knowledge in their area of expertise. And it's quite relevant because it's contextually applicable for them because they're going to study in another African country. Again, all of this has just worked towards improving their confidence, their knowledge and their skills in providing better patient care, and that ultimately translates to better patient outcomes.
My name is Jill Cranswick and I am an operating theatre nurse at the Mater Private Hospital at South Brisbane. My first visit to AusHEAL Africa Hospital with the AusHEAL team was in 2015. During this visit, the focus was on surgical counts in the operating room, and in particular, their importance, their relevance, the legal implications of not doing a count, accountability of all staff, and most importantly, patient safety. After some basic training, we implemented a surgical count, a simple surgical count in the operating theatres, and we were utilising the whiteboard in each of the theatres to record the information from those counts. During return visits to AusHEAL Africa, I was encouraged to see evidence of the surgical team's progress with surgical counts in the theatres. The counts were being completed, they were being recorded in a little book kept by the nursing staff, and in that book they were including the accountable items like sponges and Raytec, etc., as well as the instruments and patient details. So like a little operation record, if you will. and also there was a high level of compliance amongst the surgical teams. It was clear that the surgical teams have a better understanding of surgical counts, their relevance and importance to patient safety, and their own accountability. The surgical count process, I believe, is well embedded. I believe the AusHEAL team visits, combined with the short-term study grants for nurses to visit hospitals in other countries such as Tanzania, Kenya and Rwanda, are key to their further education and continued success, and also to enable them to provide a better and higher standard of healthcare.
AusHEAL has also promoted upskilling of HEAL Africa nurses in specialty areas, and those nurses now head up the neonatal unit, the intensive care unit, and the post-anaesthesia care unit, but the influence has been further afield in all areas of nursing.
AusHEAL's program to strengthen the health system in Congo is to integrate training with logistical support. Without your help and the much needed funds, we cannot continue to do this work. We need your help.